Well, today I'd like to talk to you about common symptoms after you have had a whiplash injury or a car accident that caused injuries to mostly your neck, but maybe it's your whole body. Of course, a car accident commonly causes injuries to the whole body, not just the neck, but the neck is a really common area of injury. When you're hit from behind, sitting in traffic, someone comes up and hits you from behind. That is commonly known as a whiplash injury, also called a cervical acceleration-deceleration injury. Just talking about the neck, how it's suddenly pushed from behind. The facet joints in your neck are jammed together, and it's suddenly stopped as you go forward, and the soft tissues in your neck make everything stop moving suddenly. So you can have a ligament tear, you can have a disc injury, an injury at the annular fibers of the disc called a rim lesion. So the neck is commonly an injured area. So typically after you have a whiplash injury, you might have some stiffness in your neck. This is a sign that the muscles, the ligaments, all the soft tissues in your neck are actively healing. They're in the inflammatory stage. Your neck muscles might be contracting and spasming to brace you for what just happened, to brace the injury, to prevent future injury. And this initial stage of healing might last maybe 2 to 4 days, 72 hours. The body will go from the acute stage, the inflammatory stage, to fibrocytes come in to lay down new collagen fibers or more scar tissue to help brace and provide a framework for repair. The repair stage of injury might last 8 weeks, could last up to 16 weeks, several months, and then of course after that the body goes through the remodeling stage that can last up to a year. So up to a year of recovery for some of these common symptoms in the neck or the low back. So signs and symptoms of neck injuries, it could be neck stiffness, it could be neck pain, and that neck pain could radiate down the shoulders into the arms. The neck pain can radiate between the areas, between the shoulder blades. That's a really common area of referred pain from the neck, but it can also be from a direct strain of the muscles in between the shoulder blades. So when you go to the doctor, you need to differentiate that and keep track of it. Not common directly after an injury, but common maybe like 3 months after an injury. You might start to develop numbness or tingling in parts of the hand as the injury close to the nerve roots in the neck starts to close down on the nerve roots, and that pinches off the nerve control. So that is a common finding after 3 months after the initial injury. You might start to develop that. If you start to develop that numbness and tingling, it probably means that you are not mobilizing your neck well enough and rehabbing the muscles in your neck well enough. So immediately after a car accident, you might start to develop a headache or vertigo or dizziness. And so if you have a headache after an injury, it could be from one of two things. It could be from a direct brain injury, a concussion, where some of the brain neurons are stretched rapidly or bruised as the brain goes up against the skull. Or it could be a headache that's coming from the upper part of the neck, where the upper part of the neck goes into hyperextension. It bruises the muscles in the upper neck, and because those muscles are so close to the nerves that go back to the back of the skull, that could interfere with the nerve activity, also causing a headache. Different types of structures can be injured in a whiplash injury. In the lower spine, you might have facet joints, the synovial joints, called the facet joints behind the discs, the back part of the neck. Those can jam together with a whiplash injury. In the front of the spine, the front part of the bone, you can have, like I said before, an avulsion of the disc called a rim lesion, and that can cause active swelling in the front part of the neck. And just beyond that, you can have swelling within the muscles that are in front of the bones but behind your trachea and esophagus, and those are the deep neck flexors, commonly injured in the whiplash injury too. In the upper neck, like I said before, the upper cervical muscles can become bruised from direct impact, and that can interfere with the nerve flow of the greater occipital nerve, causing headaches. Below the neck, you can have a direct shoulder injury against part of the car's interior, slamming your shoulder against the car door. And you can have a direct injury to the carpal bones as you're holding onto the steering wheel. In the mid-back, the thoracic spine, the mid-back can become hyperextended too as the car's seat back slams against your mid-back and it pushes your mid-back into hyperextension, putting a force up and pushing a force down. And that down force can also cause low back pain. An axial compression from your mid-back to your low back, compressing the discs in your low back, compressing the facet joints in your low back, causing low back pain. And sometimes low back pain, you don't feel that for several days after an injury. Below the low back, you might have a knee injury. The knee commonly hits the lower dashboard, just below the steering wheel. And you can have even a foot and ankle injury from your foot and ankle compressing the knee or compressing the brake pedal as you are hit from behind or hit from the side. So those are the common areas to the body. After a car accident, what you should do immediately, if it's a serious injury, you're going to be sent to the emergency department. You'll probably be cleared for any serious injuries with their x-rays or CT scans. But after that, after you're cleared and stabilized, you need to go see your doctor of chiropractic, a chiropractor who takes a special interest in personal injury cases. That way you can start to document the injury as soon as you can. You can start the rehab portion of recovery, where you start to get things moving in a safe and controlled manner, which will set you up for better healing in the future. So your body's going to heal anyway, but you need to make sure it heals with good function. Good mobilization, working on strengthening and conditioning the muscles in the neck again. So as your body starts to make scar tissue in your neck or other parts of the body, the scar tissue is minimized because you're exercising the muscles and getting them reconditioned again. So I'm Dr. Todd Lloyd, Petaluma, California, in the Adjust Clinic. If you're in Northern California, in the wine country, Sonoma County, Petaluma, we're here to help you.